The well-informed patient, I think, is an asset to healthcare and to society, financially, medically, in all aspects. And the reason being is because they end up triaging their own ailments before they come and see us. So as pharmacists, we like to say we're the most accessible healthcare provider. You don't have to book an appointment to come and see us like you would for your doctor. Just come, and then we can answer your question right then and there. But when a well-informed patient or a patient that has done their research comes and we're opening up dialogue, that is when they can actually, a lot of the time, give us a hint at what they're in pain of that we can help them with, and it would save so much time on our part asking all the triaging questions.
Yeah. So as a general principle, one of the things that we teach you, and we hope most pharmacists believe in, is the notion that patients are their most powerful healthcare provider, and that a well-informed patient, an educated patient, is the kind of patient that is going to respond best to the therapies that we dispense and the advice that we give. Not having enough information has historically been the problem pharmacists have faced, but now we're seeing people looking things up on the internet, looking at unvalidated sources, talking to their neighbors, looking at products of dubious quality. There are so many small but meaningful things that we could be doing differently to enhance our reputation and our credibility with the public as healthcare professionals. Introducing ourselves by name, explaining that we're the pharmacist. Those two steps, instead of just hiding behind a counter and only coming out when we're asked a question and then just saying yes, no, and then suddenly scurrying back. Asking people up front, how can I help you, rather than waiting to be asked. These are the sorts of small but really impactful steps that establish us as scientifically credible healthcare professionals.
I think that the well-informed patient is an asset to healthcare and to society as a whole, because they allow clinicians, when they come to meet them, to triage and give a hint as to what it is that's bothering them, and so that we can do our jobs easier and find out, okay, thank you for pointing out what the issue is. Now, I think contrary, or a little bit different than what Zubin was saying, for the well-informed patient, yes, it is evidence-based, and yes, we do, at the end of the day, as pharmacists and as clinicians, we have an obligation and a moral principle to give evidence-based care. I think it is important to first listen to the patient before we make that judgment as to, no, you shouldn't do this, or you should do this, and find out what evidence that they have at the table and discuss it with them and say, hey, bring the article that you thought, and let's talk about it together and see how I think this is correct or incorrect, sort of thing.
The other part of it too, for boomers in particular, especially towards the younger end of that age range, is oftentimes they're taking care of other people. So they're not coming to see us not for themselves, but because of their children or their parents. And so many boomers are involved in managing their parents' care right now. And again, that's a hugely important role that a good pharmacist can help support as well. Not simply from the medication perspective, but from a system navigation perspective. There's a lot of things that a community pharmacy can and should be.
But there is a caveat. Now, of course, the fine print is the well-informed patient. We have to understand as clinicians or inform them that they may be only seeing one piece of the cake or one piece of the evidence, but they are in no way have gone through the extensive education that we have. So it's just like we're their coaches, and we just have to guide them and steering them in the right direction. But by all means, encourage your patients, and encourage society, encourage the public to research more on their health, because it's their body.
Yep. Research more, but be literate about how you're doing it. I think that's the key.
Correct.
That it's really easy to find information, but like we worry about fake news and Russians meddling in elections, it's important to really be critically aware of what it is that you're reading, and that's where we have a wonderfully important role to play all over society.
I think we can finally agree on that.